I'll start on a rather Irish funny note. When I was serving as UN High Commissioner for Human Rights, I was moved after a few months from the terrible back corridors of the Palais des Nations into the Palais Wilson, this beautiful building on the lake. But we didn't have all of Palais Wilson. We were sharing it with colleagues who were dealing with disaster reduction. So the way I saw it was they were dealing with reducing natural disasters, and myself and my human rights colleagues were dealing with man-made disasters. But it did give me insights into the importance of prevention, the importance of predicting the problems and dealing with them. On a much more serious note, it is clear that we're going to need to be more skilled and more alert to reducing and mitigating and having disaster preparedness, as we've heard, because of the already felt impacts of climate change. I attended a discussion with some other panelists today, both John and Walter Fust, on that very subject. And there is a learning that is taking place in this focus of our launch today on securing hospitals as being vital buildings in the context of coping with the human aftermath of disaster. It's more than just dealing with one important aspect. I think it's a learning for many other measures that we're going to have to take in the context of adaptation. I come at it from a human rights perspective. With my colleagues in my current work in Realising Rights, we're very focused on bringing home that it does make a difference to recognise that health is a human right, as it was recognised in the Universal Declaration of Human Rights and the Constitution of the World Health Organization in so many different ways. And the way in which the Special Rapporteur of the United Nations on right to health, or right to the highest attainable standard of health, puts it, Professor Paul Hunt, he says, in practice it means strengthening health systems. So I see the importance of securing core health and indeed other important buildings, not just the hospitals, but also the clinics, the district hospitals, the smaller health buildings, and the other public buildings of education, schools, etc. We need to be thinking in these terms much more urgently because of the very problem of climate change. So what I would like to see happening from this launch is that the specific way in which there has been a preparation for this launch, that there has been a mapping, that there has been a securing of buildings, looking at hospitals in different regions, as we've heard, becomes itself a valuable lesson to the way in which we must break down the various components of the wider adaptation and very much emphasize the importance of disaster preparedness, mitigation, reduction, and starting in key areas that prioritize, as we should, right to health and the infrastructure to secure health even when disasters occur.